Hey, AlphaFlo friends, this is Kelly, and today I'm here with Dr. Brittany Newsham. Dr. Brittany, thanks so much for being with us.
Yeah, no problem.
Yeah, so Texas, we love that. We're headquartered here in Texas, and Texas A&M Graduate. That's really awesome. We already are like, oh, so smart. And so tell us a little bit about your practice.
So I've been all over the place. So currently working full-time small animal as well as an equine sports medicine on the side. I see everything from exotics to really like high performance show jumpers, hunters, reining horses, so on and so forth. I am passionate in therapeutics, so both alternative medicines and regenerative medicines. And I'm always up for the cutting edge, the new, whatever we can do for our furry friends without having to put them on pharmaceuticals. I'm all for it.
Love that. You have a background personally in sports, but also sports medicine with what you do with your
Yes.
animals as well.
Yes.
Love that. So tell us, how'd you hear about AlphaFlo?
So I actually ran into an old friend at EP convention and I use Renovo in my equine patients. And I didn't actually realize that there was a small animal product called AlphaFlo until I ran into him. He brought me over to the booth. I kind of chit chatted with a couple of the reps, got Ginger's number, which is great. She told me all about the product and I had like the perfect case to try it on. And I really I love it. And now I promote the daylight out of it. So long story short, through one of the representatives, through small networking and now on personal trials and use.
Excellent. We love that. Well, I'd love if you could share one of your AlphaFlo cases with us.
Of course, yeah. So, I think the best case that I have really is for a cognitive dysfunction. Surprisingly enough, when I talked to Ginger, she did say she uses it on one of her old kids. And she just said that she saw a big difference in just like the light in their eyes, right? So we had a 14, now 15-year-old female spayed Australian Shepherd. She is still trucking along and she's actually right here with me. I'm watching her walk around like a maniac in the house. But we did the treatment on her about a month ago, and we did a 2 ml vial IV, and within 14 days, cognitively a big difference. So she was more willing to eat. She was paying attention when talked to, kind of saying. We hear the old dogs, they lose their hearing and so on. With her, I think it was more of a brain deficiency, if you will. And on top of that, I do actually think it's improved her mobility and her willingness to kind of take initiative again for herself. So going out, we have 5 acres and she freely roams on that instead of needing help outside. And I think just the general factor of having her more present has been the really big thing for us. And that's not anything I would have ever expected out of the products, but is also tremendous. And I will be continuing to use it as such.
That is a great benefit. We actually used it on my 18-year-old dog and absolutely noticed the cognitive. We use it for a joint issue, but I could completely see the cognitive,
Yeah.
which is just awesome when they're in those final years. What are some other cases that either you have used or you would consider using AlphaFlo based on what you've seen?
Great question. We actually have one that's kind of pending in the wings, as you will. He's a 3-year-old, very large exotic bully. So he's more built like a pit bull, right? Or an Amstaff. He's about 87 pounds and he came in, he's 3-legged lame. So most likely cranial cruciate tear is what we were concerned about. Did diagnostics, does have some stipple effusion. So what we were actually recommending was using AlphaFlo directly into the joint for him and potentially another dose IV as well. And that would be something that I think would be tremendous in the small animal world when surgery is just not an option, or even when it is an option, placing that into the joint as well to help out with any dysfunction or degeneration or even inflammation. So now I think the benefits of an allograft like AlphaFlo, right, is that it's low reactivity, it's less likely to cause a problem, it's more likely to help and do exactly what it's made to do. So for me, I see a lot of cranial cruciate, partial tears, ruptures, pathomeniscal injury with our super active, very muscular dogs, such as our pit bulls and our pitties down here in Texas. And I do think it would be a fantastic adjunct therapy for any of these guys, because I will tell you that most of the clients in our demographic don't choose surgery just because of the cost. So it's a nice and more cost-effective way potentially to kind of provide some regenerative care and some recovery therapy in these guys.
Yes, we do love that it is more cost effective than a lot of other alternatives, minimally invasive, anti-inflammatory. Are there any other benefits of the amnion that you can think of that you'd want to share?
I mean, truthfully, the fact that it's an amnion. Amnions are not programmed to do anything specific. So, if you give it IV, for instance, I think that's a big reason why we see a change in cognitive dysfunction. It attaches onto areas that are dysfunctional, that are degenerated. And it may not completely create a miracle response, right? That's not what the guarantee is. But what it does do is improve quality of life by allowing access and ability to affect so many different cells and not just one particular cell.
Love that. So, for some of the veterinarians that may not have heard about AlphaFlo yet, or perhaps are not as progressive as you, what would you say to them?
I would say give it a shot. Any of these cognitive dysfunction cases, lameness issues, and even just general neuritis cases. I've seen a couple of those as well in small animal. I think it's not going to hurt and it's always going to help. And the beauty of it too is that it's a super safe product. So I don't think you're ever going to go wrong giving it intravenously or into a joint.
We love that, Dr. Brittany. Thank you so much. Where can
Of
people
course.
find out more about you and your practice?
And so we actually have a couple of routes. We're on Instagram, Facebook, and our website. The small animal practice is more of a private thing. The equine practice that I do have that we do small animal on the side is called High Caliber Performance. And you can find us either on Instagram, High Caliber Performance TX, or our website's www.highcaliberperformance.com.
Excellent. Well, thank you so much, Dr. Brittany. We
Of
appreciate all
course.
that you're doing out there in the small animal and large animal world.